Gundersen Lutheran is not just the largest health system in western Wisconsin. It is the largest employer in La Crosse County.
I look at the organization as another member of the community. We have a responsibility to the health of our employees, to our patients, but to the community broadly. It's our responsibility. It's in almost every one of our mission statements.
Under the leadership of Dr. Jeff Thompson, a pediatrician and neonatologist by training, Gundersen Lutheran has launched several initiatives, all of which tie into the IHI triple aim: improving the patient experience of care, improving the health of populations, and reducing the per capita cost of care. The Care Coordination Program for patients with complex conditions is foundational to Gundersen's goal of transforming healthcare.
It's a team effort, absolutely, and it's a primary care provider is a hub with the nurse coordinators and social workers coordinating with multiple patients, families, and providers.
They schedule appointments with specialists. A lot of times they'll visit a patient at home. They can arrange for home care. And they see the patient as frequently, probably more frequently than we do. And they can pick up on subtle signs that tell us that the patient needs more attention.
Ann Morkrit is one of those patients. A quadriplegic as the result of an auto accident, Ann is reliant on her team to manage her care and keep her out of the hospital.
They're such a strong support system for me, getting me things that I've needed.
Since her discharge from the nursing home, Ann has not been readmitted to the hospital. Potential crises have been averted, and Ann has enjoyed a better quality of life. Coordination of care not only reduces emergency department and inpatient utilization, it also improves the workflow for primary care doctors.
Recent 2012 spring survey indicated that over 42% of providers viewed care coordinators saving them over 30 minutes per month per patient.
Fighting obesity is central to improving the health of the population. Gundersen has developed several nutrition and healthy eating programs to guide kids and their parents.
The biggest challenge has been just conveying the message that this is healthy food. It's not bad, it's not yucky. Just getting the kids to try at least one bite. And we found that if they try it over a period of time, they actually like it.
Gundersen's executive chef, known throughout the community as Chef Thomas, has become a Pied Piper of sorts, guiding families on the road to healthy cooking.
We write recipe cards, and we put the principal on with my picture on the recipe card and give all the students a recipe card to take home, and then they can say, hey Mom, hey, let's make some of Chef Thomas's roasted vegetables.
And when there's no time for cooking, Gundersen's 500 Club program helps families make healthier choices when they're on the go.
I know for parents who have kids and they might be going to a soccer game or football game or something like that, stopping at a convenience store and picking up a 500 Club item is very easy now, and it helps people to make the easy choice, the healthy choice.
Started 30 years ago, the 500 Club partners with local restaurants, supermarkets, convenience stores, and vending machine companies to identify foods that have fewer than 500 calories and less than 15 grams of fat. Gundersen partnered with Courtesy Corporation, owners of the local McDonald's, to identify healthy choices at their restaurant.
The vision of the 500 Club really meets our vision in helping customers know and understand what choices are available. And it's been a great hit in the community, and we're very proud to be affiliated with the 500 Club.
By educating its neighbors and partnering with local organizations, Gundersen is improving the health of its community to reduce obesity-related illness and keep healthcare costs down. Another way Gundersen is working to control costs is by controlling its energy consumption. Jeff Rich leads the organization's Envision program.
We really have four foundational pillars for this program. The first one is energy, and that has two subcategories such as conservation and renewable energy, but also waste management and control, trying to reduce our waste, Third element or foundational pillar is recycling and try to increase our recycling rate. And then the fourth one is sustainable design so we don't repeat the mistakes of the past.
Gundersen developed and owns wind turbines that generate electricity and has partnered with the county to harness methane gas from a local landfill, which now powers and heats 2 buildings with 350,000 square feet between them. They are on track to be 100% energy independent by 2014.
Spend $2 million on conservation saved us over $1 million a year. That is a return on investment you can't find on Wall Street, at the bank, certainly not in your checkbook these days. So we use that as a starting point in saying, this is smart sustainability. This isn't just doing it because it's nice. It's doing it because we're going to make money.
The comprehensive recycling program saves about $70,000 a year. One innovative piece of that program takes material used to wrap surgical instruments and, with the help of senior volunteers, turns it into tote bags and aprons, seen here in use at the daycare center.
We don't have to do everything. We can lead, we can instigate, we can share responsibility. But as a healthcare organization and as the largest employer, people pay attention when we lead.
To learn more, visit gunluth.org.